Hello everyone, today's topic dedicated to the topographic anatomy and operations on the thorax and organs of thoracic cavity. Let's begin. Thoracic wall. No, I will not stop on the borders of thoracic wall and on the lines of the thoracic wall. I suppose that you already knew this, already knew from the internal disease, for example, or the parasternal mid-clavicular line. You should already know this. That's why let's speak about the main features of the thoracic wall and the practical meaning of it. First of all, I wanna tell you about intercostal space. Intercostal space, what is it? Intercostal space is the interspace between the ribs. It's obvious. But what we can find here, first of all, what is the border of the intercostal space? Superior and inferior, we can find the ribs. Anteriorly is the external intercostal muscles, and posteriorly internal intercostal muscles. Here. Between the ribs and muscles, you can see neurovascular bundle. What is this neurovascular bundle? It consists of intercostal vein, intercostal artery, and intercostal nerve. Sure, in this space you also can find some volume of fat. Take a look into location of this neurovascular bundle. It locates just at the inferior margin of the rib. If you remember from the course of human anatomy, the inferior margin of the rib has a groove called costal sulcus on Latin. So in this groove we have a neurovascular bundle, we have blood vessels, and the nerve, intercostal nerve, locate just at the inferior margin, not in the groove, but it is inferior margin. Remember this forever. Why? Because it's very important. You can see that behind the internal intercostal muscles we have endothoracic fascia, we have a parietal pleura, and between the parietal and visceral pleura we have a pleural cavity. So, during different patients' conditions that called hydrothorax, hemathorax, it could be fluid inside of pleural cavity. And to evacuate this fluid inside of the cavity, we should to make a pleurocentesis. Pleurocentesis means puncture of the pleural cavity puncture. And how we can do this? How? We cannot apply our trocar, our system for pleurocentesis at any point we want. No. You should keep in mind, as for any surgical manipulations, we should keep in mind some rules. But the basic rule, introducing a needle, introducing the catheter at the superior margin of the rib, superior, never at the inferior margin, only at the superior. Because if you introduce your catheter at the inferior margin, you can damage the intercostal nerve, intercostal artery, or intercostal vein. So, pain and bleeding, arterial profuse bleeding. Remember this, and never introduce a needle at the inferior margin of the rib. What's about the neurovascular bundle, intercostal neurovascular bundle? You can see on these pictures. So basically we can speak about anterior and posterior intercostal arteries. We can divide it, but it's joined together, making like one big semicircular arterial anastomosis. So posterior intercostal arteries arises from the aorta, from the thoracic part of aorta. Here it is. And anteriorly, it's also arises from the internal thoracic artery. So imagine this artery has no distal end with a lesser blood pressure. No. In case of injury, both of ends will make a fountain bleeding, arterial bleeding from the aorta, from the internal thoracic artery. Here it is. And in the closer to the columna vertebralis, to the vertebra, the neurovascular bundle locates in the middle of the intercostal space. And position at the inferior margin, it has only at a distance from the scapular line, till the anterior axillary line. After this is also can make many branches after anterior axillary line, and locates in the middle of the intercostal space. Internal thoracic artery. What is this artery? This is small artery, but has a big meaning because it has many big branches. First of all, let's take a look where that locates. Internal thoracic artery arises from a subclavian artery, going downwards. It is a bad artery, as you can see, and locating at the margin of the sternum, from the internal part of the chest, margin of the sternum, and in the lower parts it's covered also with the transversal thoracic muscle. Here it is, on the one side, on the other side. It has such branches as the intercostal arteries, as I mentioned before. It has such branches as the musculophrenic arteries that give a glassy line for the diaphragm. Pericardiophenic arteries giving a blood supply for pericardium, and also inferior or superior gastric artery, superior epigastric artery that supplies the abdominal wall. Here it is information that I already told you, and all branches. Okay, that's listed. Pericardiophenic artery, or arteria pericardiophenica, this arises at the level of the first rib and supplies the pericardium and the diaphragm. The second one is anterior intercostal arteries, also mentioned about it. It supplies the first and the sixth intercostal spaces and anastomose with the intercostal arteries. The next one, arteria musculophrenic. Musculophrenic gives anterior intercostal branches to the 7th and 9th intercostal spaces and also supply the diaphragm. Radii perforantes, or perforating branches in English. It is branches that go into the mammary gland. And the last one, arteria epigastrica superior. Superior epigastric artery is a continuation of the internal thoracic artery, which supplies abdominal wall and making anastomosis with the inferior epigastric artery. So artery is accompanied by the same vein and parasternal lymphatic nodes. The next subtopic is a diaphragm. Okay, just take a look on the diaphragm. We know that it is a muscular septa between the thoracic cavity and abdominal cavity. From the thoracic cavity, it's covered with parietal pleura and the thoracic fascia. From the side of the abdominal cavity, it is covered with parietal peritoneum and the abdominal fascia. But what we can tell about diaphragm? Diaphragm has parts, muscular parts, and tendinous center. Here it is, tendinous center. Here it is. Around of it, we can see muscular parts. And muscular parts we can divide into the sternal parts. Here it is, sternal parts. We can divide into the costal parts, and the lumbar parts. Here it is, lumbar parts. There are many openings in the diaphragm. These openings is for different organs and big blood vessels. First of all, from the right side in the tendinous center, you can see a big opening. It is the opening for vena cava inferior, for inferior cava vein. Also, if we take a look into the lumbar part, we can see fibers or muscles making the pedicles of a diaphragm. We can divide these pedicles into the medial, intermediate, and lateral pedicles. Medial, intermediate, and lateral pedicles. Okay, so medial pedicles arising from the surface of the vertebra, of the lumbar vertebra, and making two openings. The first opening closer to the vertebra, it is hiatus aorticus, aortal opening for the aorta. The next one is anteriorly from the aorta. It is esophagus opening for the esophagus. And if you see esophagus, remember that near the esophagus we always have a vagus nerves, both of them vagus nerves. So between the medial and intermediate pedicles we have like a slit, like a fissures for the azygos and gemi-azygos veins. Azygos from the right side and gemi-azygos from the left side veins. With the azygos and gemi-azygos veins, we have splanchnic nerves, greater and lesser splanchnic nerves. And between the intermediate and lateral pedicle, we have a fissure for the sympathetic trunk. I will not stop on this information. The skeletopy, fissures, I already mentioned it. Weak places of the diaphragm. Yes, weak places. What are the weak places? The places without muscular layers, which locates between the parts of the diaphragm. So there is a lumbocostal trigonum of Bagdalek. There are two trigonums, right and left, which just locate between lumbar and the costal parts. And sternocostal trigonums, Larry from the left side and Morganii from the right side. This locate between the sternal and the costal parts and contains superior epigastric arteries. Okay, let me show it. So here it is, sternocostal trigonums. From the left side, it is a trigonum of Larrey. Here it is a fissure. And from the right side, it is a trigonum of Morganii. Here it is. And here you can see very good shown here from the left side is a lumbocostal trigonum of Bagdalic. Lumbocostal trigonum of Bagdalic. Here it is from the one side. Here it should be from the other side. Here. So, okay. See you the next time.